Hi, I'm Josh. I'm a nurse here at Children's Hospital Boston Emergency Department. It's summertime and children and families are out playing, especially in the water. And here at Children's Hospital, we are seeing a rise in water-related emergencies. So we thought we would take a moment to review the steps of basic CPR with you. The first step of CPR is to assess if the person is awake or not. Are you okay? Are you okay? If there's no response, you should shout for help or send someone for help. If no one's available to help you, you must act. Time is very important when trying to save a life. The first thing you want to do is remove the clothing so that you can work. Open the airway by doing a head tilt chin lift. You want to lift with your fingers on the chin and hold the head at the forehead with your other hand. And you want to lean in and you want to look at the chest, listen for breathing, and feel for any breath against your face. And do that for about 5 to 10 seconds. If there's no breathing, you need to give 2 breaths by pinching the nose and making a seal against the mouth. You should see the chest rise with each breath that you give. The next step is to check for a pulse by using 2 fingers on the side closest to you. You should check for a pulse for about 5 to 10 seconds, and if you don't feel a pulse, you need to start with compressions. Place the heel of your hand between the nipples on the chest, right over the breastbone, and interlock your fingers together. And you should push 1/2 to 1/3 the depth of the chest, and you should do 30 compressions. 1, 2, 3, 4, 5. As a nurse, I've taken care of many children that have come to us after suffering a near drowning and they've been pulled from a body of water and had CPR performed by family and friends. Knowing just a few basic steps of CPR might help save your child. 29, 30. Continue with cycles of 30 compressions to 2 breaths for 5 cycles. And if help hasn't arrived after 5 cycles, you can leave the child to phone for help. When you return to the child, you should continue with compressions and breaths until professional help arrives. And remember, this is not a substitute for a formal CPR course. We urge you to sign up for a course in your community, and you may be able to save someone's life.